welcome back to the channel. This is Not a Real Doctor DPT, and my name is Eric. I am a licensed and practicing doctor of physical therapy, and today we're in the second of a 5-part talk on the basics of the field of physical therapy. Last time we covered what is physical therapy, and we ended talking about how physical therapy is basically the art and science of putting a patient's body into the best position so that it can heal itself with the care of physical therapy, whether it be manual therapy, the tools of manual therapy, or exercise. We also ended talking about the thought, and this is, if there's no other thing that you hear from any of the series, the most important thing for you to remember is how we ended the last video, and I'm going to continue this throughout all 5 videos, and really throughout the entire channel. The main thought would be, and that goes to today's topic of why you should seek a physical therapist, or why one of your family members or a friend should seek physical therapy care, and that is if you are having pain with movement. If you get pain with movement, your first thought should be, I need to go to a physical therapist. Now, depending on where you live, I don't know what it's like in other countries. I'm in the United States, and in the state where I reside and practice, if you do not have Medicare, then you're able to see a physical therapist typically for approximately 30 days without a referral from your physician. However, if you are a patient with Medicare, or if your family member has Medicare, then you do need to seek medical referrals first, but then you can go to a physical therapist with that referral. So if you are having difficulty walking, if you are having, because of knee pain, if you're having shoulder issues, if you're having a neck problem, you can't sleep at night, if you're having difficulty picking up glasses, you'd be surprised how many patients will come actually into the orthopedic clinics with that being an issue, where their hands are just weak, and so they can no longer pick up a glass that they used to pick up. If you're having any of those conditions, or anything similar to that, your first thought should be, I need to seek a physical therapist. Most often, you're going to get into an outpatient orthopedic clinic for that type of a thing. And I'll detail this a little bit more in the when segment of this video series. But there are multiple types of physical therapy care that you can receive. So that's going to be everything from outpatient orthopedic, that's generally going to work in that area more on pain management, more higher functioning type of patients. There are other areas of physical therapy where you may receive care for, say, more neurological rehab. So looking at neuro care for post-stroke patients, say, for patients who've had spinal cord injuries. Those kinds of patients can be seen by neuro rehab specialists in physical therapy. Depending on the setting that you're in, you may also be seeking physical therapy care, say, if in a skilled nursing setting. So oftentimes, if a patient goes into a hospital and has a joint replacement, they might not be ready to go home because maybe they live by themselves. So they're going to go to a skilled nursing facility where they can receive some individualized attention over 2 to 3 weeks to help boost them up, so then that way they can come back home. And while they're in that skilled nursing facility, they will receive that care of a physical therapist in that location. When they're in the hospital, right after they receive that surgery, then one of the first people that they wake up to is a physical therapist saying, okay, let's start moving. And once a person was to discharge from either a hospital, if they're healthy enough to go home, or if once they're healthy enough from a skilled nursing facility, then they'll go into a home health setting, and they may receive another physical therapist and to care for them and see them in that setting. So physical therapy runs the gamut of as far as the conditions, or as far as treating patients with conditions that are impairing that patient from moving. So ultimately, the thing that you want to remember and the thing that you want to keep in your mind is, as far as why a person should seek a physical therapist and why a person should seek any physical therapy care, it should relate to, are you having difficulty moving? Are you having dysfunction with movement? When you move, does it hurt? Is your range of motion not as good? Oftentimes, and I'll mention this also in the when segment a little bit more, but just to give an idea on that, if we can catch in physical therapy a condition early enough to work on that pain, we could help prevent a surgery from ever needing to happen. If you can work on those arthritic joints early on, we can get it moving. We can strengthen the musculature around it so that the joint is not having to work as hard. Once that happens, then joint replacements that may be called for from the medical side may not have to happen, or may be delayed for several years. So the main point of this video of why to seek a physical therapist, and really the point to remember throughout this entire series, and that I would hope to leave you with more than anything else, is if you are having pain with movement, if you are having problems with moving, you fall when you move, you can't stand up out of chairs, when you do move it hurts, the first thought in your mind should be, I need to go to see a physical therapist. I can't harp on that enough. I can't say that enough. And I hope that gets across well here to you. So that is why you need to seek physical therapy care. Tune in for video number 3 in this series, when we're going to get into when a person is seeking physical therapy, and some of the areas that I'll talk a little bit more in detail about some of those areas that I mentioned here in this video. But thank you so much for tuning in. And again, I hope you've learned a little bit, and I hope I've been able to teach and just open your eyes just a little bit more as to what physical therapy is and why you would need to seek a physical therapist. If this was something that seemed to be beneficial to you, please subscribe to the channel, and I look forward to seeing you next time. Bye.